Section 3 or the last section. Here we're going to talk about what demographic they're going to use healthcare services. Number one going to be infants and older adults. Regardless of our financial situation, whether we are poor or rich, if we would have infants or older adults in our family, we're going to definitely take them to the doctor if they would have any sort of problems. Another demographic that visit doctor periodically, it's going to be women in general. Your book actually said that women's medical care is just more fragmented. Fragmented is just very controversial term, and your book didn't clarify the idea here, which I'm gonna do that now. But fragmented basically means women, I mean, they have a lot going on with their organs. For example, they're gonna go through pregnancy, they're gonna definitely give birth if they are pregnant. And if they are not pregnant, they're gonna go through menopause and all that. Like it's just a sequence, developmental sequence for all women. So they definitely visit doctor more and more because of their body and their system. But this is not the case for men. Like they don't have that kind of phases in their body. So that's why women's system is just more fragmented. Men, they are expected to ignore pain and not give, I mean, they are not actually paying attention to their illness. Which I would say it's not the case nowadays. Yes, back then men I mean they were like kind of ignorant when it comes to their body symptoms and all that. But nowadays, because of the education, we can see men they're gonna visit doctors more than before. At least in my crowd, like people around me, they are like literally going to doctor even more than me, which is good actually, good for them. But I feel like the information should be a bit up to date. I wouldn't say men would visit doctor same as women, but nowadays they're gonna do that more compared to before. Just give me a minute. I'm talking so fast. But yeah, another important factor gonna be social class and culture. I have to visit doctor. I'm coughing. But yeah, another important factor gonna be social class and culture. It seems like lower socioeconomic status, I mean, they have like they do have financial problems, so probably that's why they cannot have more access to healthcare services. And this is like on governments and policymakers to just provide some sort of facilitation for them to just I mean like some sort of aids or something like that that could just help them just go and visit doctors for free if they are coming from low income families. I mean, yeah, I'm pretty much mad towards US government because like in my country, I wouldn't say everybody can just have access, like even regardless of their socioeconomic status, but healthcare services kind of free for some minor problems. But here you have to pay for everything. And if you wouldn't have insurance, it's you're gonna get into a big trouble. It's not good, especially for low income families. But another point here is social psychological factors. They are very important in using healthcare services. For example, people's attitudes and beliefs towards health services and symptoms is just very important. For example, my grandma, she didn't believe in healthcare services. She actually thought if you would go to hospital, they're gonna kill you because the doctors, they are not good. And hospital itself gonna make you ill. It was her belief, and I guess that's why he actually I mean passed out when she was just 51 something, because she never believed in doctors and all that. So people, they are just different when it comes to healthcare services. Probably they do have a bad experience that's gonna lead them to just follow that belief. But if you would go to a good doctor, you want to change that, because doctors, I mean, they can be good really. But yeah, another point is children, they're gonna learn about using healthcare system from their parents. If your parents, they're gonna take you for visits at least like once or twice in a year, it's gonna be in your system that you have to check doctor all the time. It's gonna be in your brain. So you're gonna learn that from your family, from your parents at some point. Um, Psychological complaints, yeah, that's what is really killing me. It seems like doctors, they are just kind of pissed off about patients gonna visit them and just complain about some sort of problems in their body that is not actually existing. For example, they would just say that, yeah, I do have stomach in my pain, but that kind of pain is not real. It's just coming from their psychological condition, like the one that we're talking about in hypochondria. So they are saying that, so some people, they do have some psychological problem, and that's why they are complaining, and it's not good. It's bad for healthcare services because it makes doctors busy and take their time for some symptoms that is not existing, so they cannot actually pay enough attention to someone that is really ill. I mean, still they do have psychological problems, so doctors, they can just ask them to just go to a psychologist, fix those problems, and just go back to the doctor. I mean, doctors, they shouldn't complain about that. I don't know why, because like they're gonna charge you anyway, so why they are just complaining about that? So yeah, so it's gonna be one point that's gonna disturb doctors when people, they do have hypochondria. Delay behavior, whenever you are just putting off seeking treatment for one or more potentially serious symptoms. For example, you do have a pain in your heart, but you're gonna just put it off all the time. So suddenly it's gonna be a heart attack. You shouldn't do that. It's not good. Delay behavior has like different phases. The first one gonna be appraisal delay, whenever you do have symptom, but you are not taking them seriously. Illness delay, it's gonna be, it is very important. Illness delay, it's gonna be the time between the recognition that is a symptom is just very important, and decision to seek treatment. It's gonna be illness delay. Then we have a behavioral delay. It's going to be the time between deciding to seek treatment and doing so. Lastly, it's going to be medical delay, which is going to be the time between like you're going to call for an appointment and your doctor going to give you the appointment. There are going to be like different causes when it comes to delay. Like I said, some people, they just don't care. Like my grandma, they don't care about going to the doctor. They are phobic about medical services. Um, and some of them, they do have bad experiences. Um, so here in the last section, we're going to talk about causes of delay. Um, I would say, for example, when you have like a pain in one of your organs and you have that on and on without that pain would be increasing or decreasing, you're going to be kind of habituated to that, so you don't feel like urgency to go to doctor. I don't know if you ever had it or not, but like whenever I'm working out a lot, I do have some sort of back pain, but it is like it's not that much serious for me to go to doctor, and it's not that kind of what is that, like weak pain as well. Like it bothers me, but when I'm just looking at the consequence, I'm like, okay, it's here and it's just come and go every 2 months, so probably it's okay. Yes, I have to go to the doctor, even though it's not urgent, but it's a condition and we have to address that. Um, so another point about causes that gonna bring us delay is that kind of cause, it should just alarm us. Like we should actually feel like it's a serious problem to go to the doctor. And if we would just put it off, um, it might be a big problem, but most of the time, because of our time, like we don't have time to go to the doctor all the way, so we don't care about them. And the last cause of the delay gonna be your provider. Some providers, they don't have time, like at the moment, like they are booked all the way for 2 months in advance, so they wouldn't give you a very quick appointment when you need them, and when actually the appointment gonna be arrived, like after 2 months, the pain is just gone. So you would tell yourself, okay, I don't have any pain in my back, so why I should just check the doctor after 2 months? So it can bring you delay. If you would have some sort of good providers or some sort of good system that if we would have pain, we could just schedule a visit right away. Probably there's going to be less delay in our seeking treatment and all that. So that was all about this chapter. It wasn't that much hard. It's just an easy chapter, but it does have some very important meaning and concepts. I need you to just read the book. I need you to just check the lecture because there are going to be some questions here and there. And if you had time, I want you to only check your final project's lecture because I know it is like the week after the spring break now, and you might be less busy. I don't know. But just check the final project as well. And if you had any questions, just let me know. Another point is the quiz for final project not going to be open until the week of that lecture. So only thing that you need to just go over is just the lecture of the final project, and that is all. So thank you so much for listening to me. And if you had any questions, like always, you can just email me. Thank you. Bye.